people are going to be coming in moment by moment here, but I'm just going to share briefly what we talked about in our group, and then Dara, if you can briefly share as well what you guys came up with, that'd be helpful. So in reference to cognitive manifestations of trauma, some of the things that our group kind of came up with was, one, kind of lack of focus or lack of concentration, right? So your ability for your cognitive abilities in general to be as sharp as what they were are likely not going to be optimal. We also mentioned this kind of negative emotion piece of I'm not good enough. So maybe you don't, you no longer fulfill some of your roles and as productive as you did in the past, and you kind of have the self-esteem piece of I'm not good enough, and certainly you don't feel as if you're optimally functioning. We also talked about someone's out to get me, right? So this hyper-vigilant sort of piece of someone is definitely out to get me in some way. And we briefly said that that might actually be the case, depending on what your environment is. So we have to be sensitive that it's not always like this irrational sort of thought that someone's out to get me. It can be a real thing, depending on exactly what your environment is. And last but not least, we talked about just kind of a fear, a general sort of fear. And family court was kind of identified as the example here. So imagine that you've been attending family court and the proceedings and the judgments aren't necessarily going your way. You might develop a fear-like sort of response, which is cognitive and emotional at the same time, that you just feel like the outcome isn't just going to be in your favor. So those were some things that we kind of came up with in our breakout room. Dara, I want to allow you to just briefly share what your room talked about.
You have a really long list.
I say maybe just for the purpose of time, and I think we're done at 12, right? So we don't have a lot of time left. Is it 12 o'clock is the time that we're ending there?
No, we're done at 1.
Oh, I was, I'm glad you said that because I was about to go full speed ahead
Oh
and
no,
I was, that's
we have
helpful. All
time.
right. All right, please. All right. So please go ahead and share maybe the common ones there.
Sure, I'm gonna do some normal ones or more typical and some atypical. So we
Okay.
said angry outburst, quick tempered, breaking things, domestic violence,
Mm,
yelling, leaving, disappearing, self isolation, not taking care of yourself, letting yourself just kind of go, gambling, promiscuity,
mhm.
um, overly critical of others, blaming everybody else except yourself, yelling, lack of hope, not trying.
Yeah, no, all those are certainly common ones. And I think the one that you mentioned a moment ago that may not be as easily identifiable as some of the others is promiscuity, right? And so someone who is looking for comfort in other relationships, right? And so on the surface, it looks like this person is just doing too much in reference to intimacy relations, but all in all, it can be a search for feeling as if you are valued, right? And intimacy certainly is one way in which we consider ourselves to be wanted or valued by others. I'm not painting the picture that that's the only reason why promiscuity happens, but of course that certainly fits. And so I really like that one. Did you also say domestic violence, right? Okay, so domestic violence in reference to a lot of times with respect to someone who's experienced something that impacts them, it's more of a displaced anger, right? So it's really not about the person that's receiving the violence. It's about what that individual is experiencing themselves, but they don't really have consciousness of that. And I'm certainly not excusing DV for any reason, so please don't mistake me on that. But you can certainly see a lot of people getting into those situations. And another common one that's along the lines of domestic violence is punishment toward your children, right? So you may see your child as disobeying and needing to be, punished in some form or fashion. But my encouragement to parents all the time is how much of this punishment that's needing to be done is about the child's behavior and how much of it is about you, right? If it's about you, then it's really not a punishment for their behavior. It's more about you letting out this displaced sort of anger as well. Just to kind of respond to a few of those, but we can go comprehensive on the behavior piece. Clearly, alcohol and drinking and kind of masking one's own reality is a very common one. I think in my clinic, when I work with people with PTSD responses, they don't always see the fact that by having 3 drinks a day to deal better with the incident as a problem, they see it as like, oh, well, I'm not as symptomatic as I was before, and so this must be a good thing. But in actuality, you might be pushing that bubble and it's popping up in another area as opposed to truly sort of dealing with it, if that makes some sense. Okay. All right. I'm going to transition to the next part of our discussion here today. Listening. And this is, once again, this is the gist of what we're here talking about today. So whether it's us talking about, and the trauma is just really the example that we're using, the tangible, concrete example, but there are many sensitive topics that people have been impacted by. So I don't want you guys to just put this in the box of trauma here today, but if you are put in a position where you are the individual who is going to be listening or addressing the situation with someone else, a sensitive topic in general, we tend to not do very good with that. And let me just kind of mention this as kind of the first sort of issue. Many people want to solve the problem of the other person, right? So someone may come to you and say, you know what, at work, I am being treated differently than everyone else, and I feel as if this is based on my gender or based on my race or based on whatever the case may be. And then the person on the opposite side, if they say, well, this is what you need to do. You need to go to HR. You need to file a complaint. You need to file a grievance. You need to do this. You need to do that. And you may say to yourself, I'm not ready for all that. I really just wanted someone to listen to me. And so I guess I want to start this part of the discussion off with a cautionary piece. Don't be the person to provide solutions too soon. If someone's asking you, what do you think I should do about it? That's different. But it is very important that we initially provide an ear, allow the person to cathartic, fancy way of just saying, get out what's going on inside of them, so that they can be able to process through whatever took place. So once again, you guys got to be thinking we're talking about sensitive topics in general, not just traumatic sort of events, right? So that's the first part. Don't be the problem solver and prematurely kind of giving people what they don't need at that time. That's even relevant for my business, right? So if I am working with a client and they're telling me about something that happened to them in the week, and I just give them advice, right? Like that. First of all, that's not therapy, that's advice. And secondly, that might not even be what they're there for. If they're coming to someone as a professional, they're looking for the broader sort of view of things. And it certainly starts with listening. So I'm going to talk to you guys about just kind of some basic sort of listening skills and strategies. And then we're going to have a little bit of a role play that we're going to do here today. So I'm going to ask whoever took drama and whoever, has a mini bit of an acting sort of background that you be thinking about it. All right. Sounds like Armando has my back. I appreciate you, Armando. All right. And I'll paint that picture when the time comes. Okay. Right. So listening, first of all, listening creates feelings of trust and understanding, right? I want you to just kind of think about this for a moment. Think about a time in your life where someone allocated time to you and was like, look, you got the floor. And you were able to talk about whatever it was that was impacting you. Chances are very high, for one, for you to call on this person and been able to, open up yourself to that person. You already had a certain level of trust. But when someone truly listens to you and shows you that they're listening through some of these basic skills, it creates feelings of, I am understood. I have value. I am someone who is worthy of feeling the way that I do, as opposed to, I shouldn't feel this way, or maybe I'm not strong enough. Maybe I'm doing something wrong here. All those are likely sorts of things. If, you pick up the phone and say, you know what, I heard something went on in your life. I got a couple minutes, right? Like that's not setting the stage for someone who's going to exhibit signs of listening and understanding. So I just want to say that first, is that listening creates feelings of trust and understanding. Listening also allows the person who's been through what they've been through to start the process, to process through their cognitions, which we talked about a moment ago, their thoughts and their feelings, right? So it allows that process. We as human beings don't go from trauma or sensitive situation to full acceptance in a brief period of time. It takes some time to get to the other side. And we use the verb process as a method of getting to that point. And so listening certainly allows the other person to process through their own personal thoughts and feelings. And sometimes it doesn't even require you to do anything, but just kind of sit back and be that listening ear. It doesn't necessarily require you to have any version of skills other than just, I am offering myself to you at this point, and I'm willing to listen to whatever it is that you've been through. And so just to kind of paint the stage for you there, not to, put any version of pressure on any of you to all of a sudden become some very skilled, mini therapist. But I will say this, I think you all have a therapist inside of you. Your barber has a therapist, your dentist has a therapist, well, some do, but hairstylist, your nail, anybody who you tend to deal with, who you tend to feel like, I have a relationship with this person, they have some therapist skills already in them. And so I want to make that part clear that, it's not just the professionals who have these abilities. Okay. All right. So let me preview for you guys the three sort of basic listening skills that we're going to talk about here today. All right. And the first one is called a summary. Pretty simple. It's not really more of what it even sounds out to be. Someone shares their experience, and what you do is you paraphrase what you heard them say, right? And it's not, with this one, you do have to be careful not to drag out your summary and make it so long and drawn out that, you stumble on yourself. This is a rather brief version of a summary, and you're basically just paraphrasing what you heard them say. And I can guarantee if you're able to do this, and you're accurate with your summary, what they're going to say is, yeah, that is the way, that is, you got it. That's what I felt. And they're going to expand and go on above and beyond that. So we all very likely do some version of this in our own day, in our own lives. And you kind of just don't realize it. But if we're conscious and purposeful with it, it can be even more effective. Okay, so here's an example. I'm going to play someone really fast, but I witnessed somebody being brutally assaulted today, and I'm really not doing well, and I'm having a hard time not thinking about it. I just keep picturing it in my mind over and over and over, and it's just really difficult for me. Here's the summary. You were impacted by witnessing that assault, and you're struggling to focus, right? That's all we're really at. I'm not asking you guys to break down each and every word. You were impacted by witnessing that assault, and you're struggling to focus. And that took that brief little snippet of what I said, and that just kind of broke it down. So guess what the person would likely say as a result of that? Yeah, that I am struggling to focus. And they'll probably expand on that. Like I'm having a hard time concentrating. I'm finding myself really, not present for my spouse. Work is really, not, my productivity isn't there. And so as you see in this kind of brief example, that just by a summary, you allow that person to feel heard, and you allow them to kind of, now they got like a second sort of direction that they're going. And so that is a summary or a paraphrase, right? Okay. Secondly, we have what we call a reflection. And a reflection is kind of like stage number 2 of a summary. And so what it does is it's the paraphrasing plus you add the emotional component to it, right? So if someone were to say, well, I witnessed someone being brutally assaulted, I'm not really doing well, having a hard time not thinking about it, I just keep picturing it over and over in my head, and I feel really angry that I had to witness that, and I'm feeling devastated that someone would actually do that to someone. And I guess even take this to our environment here with some of the assaults that have happened against people of Asian descent, right? So for us to even witness this over and over vicariously on the television and see these elderly people being assaulted, chances are you feel pissed off and you feel angry at why someone would decide to do that. And so that's just kind of a concrete real life example, but the reflection, once again, is the paraphrase or summary plus the emotional component to it. So you were injured, or excuse me, you were impacted by witnessing someone who was assaulted. You're struggling to focus and you're really angry about that, right? Like you're really pissed off about it. I'm sensing that you're really upset about that. That's all the reflection is, right? And so if you, as the friend or the mentor or the provider or the father, or whoever you play in that sense, if you are not able to connect on the emotional level, chances are that you're missing a piece, right? And when I say connect on the emotional level, I'm not asking you to be some expert who, is able to talk about why and the prevalence rate and so forth and so on about the emotion or the incident. All we're asking you to do is basically just say what it is that person just described how they feel. So I'm hoping that doesn't feel like some complex skill set. And I'm going to even give you guys an opportunity to engage in a little bit of what we're talking about here today. But those are two really important ones. Last but not least, the inquiry phase, right? And so, and maybe I went backwards on this now that I think about it, but the inquiry phase is really just asking some relevant and brief questions to get the person to share their story. So let me share with you guys just a couple ways in which, a couple examples of kind of what might qualify as inquiry stage. What happened? Are you okay? How are you doing? Is there anything I can do to help? How are you feeling? Right? And so these are just kind of basic questions. This isn't anything completely out there in terms of questioning, but by asking those questions, maybe where someone has kind of gone inward and isn't necessarily willing to just pour the beans, for you to ask what happened, that is opening up the stage for us all to be able to allow this person to give their story. And so I think it's important that that we understand that. Okay. All right. So I want to ask for a volunteer, Armando, I believe. You mentioned that you were willing to do this. All right. So I'm going to give you an opportunity to do a summary, right? So I'm going to play the person who has gone through something, and then your goal here is to basically just paraphrase or summarize what you heard me say in a somewhat brief and concise sort of way, as opposed to being dragged out. All right, so let me think real quick who I'm going to play here.
Be easy on me.
There you go. Be easy on you. I'm going to take it easy on you. All right, so how about this? I am, just to preview it, I'm going to be someone who recently got laid off from their job, or I got fired from my job, actually, right? So, all right, and seeing, I just really just think that it's completely unfair. I've been working for this job for 15 years. I've given my blood, sweat, and tears to this place, and I had a bad week, but I don't think that it was enough for me to get fired. Like, I mean, for someone to get fired, they need to be written up. They need to get opportunity to do better, and there needs to be some time. And I don't feel like I was afforded any of that. I just got treated really badly, and this is really, I'm really pissed off about this, and I don't know what I'm going to do from here, but it's really just bothering me.
Let me correct me if I'm wrong, but what I'm hearing you say, Jason, is that first, you've been there for 15 years. You feel that it's not fair what's happening to you. This really has you stressed out, and you kind of don't know what to do at this point. Am I correct? Is that what I'm hearing?
Right there. I would stop right there. And Armando, I got to give you an hand clap for that, because your skill set is, I don't know what you do, but you certainly have a knack for this. And here's even what I like that you did even more so. You said, correct me if I'm wrong. By saying, correct me if I'm wrong, you open up the door for that person. If you were off base, they can say, well, you know what? That wasn't really it. This is what I really felt. As opposed to if you just give your summary, you're off base, and in the back of their mind, they're saying, what the heck does this person talk about? He's completely off. So I really like your prefix. And then you were completely accurate in terms of what I was experiencing too. And so once again, you clearly have, whatever you do in your work, you clearly have some skills on this, and that was wonderful. And so, good job there. Good job there.
Appreciate your feedback.
For sure. I'm going to give a second person an opportunity to do the reflection. And so just to kind of reiterate, the reflection is the paraphrase, which Armando did very well there a moment ago, plus the identification of the emotional piece. So I'm going to lay it on a little thicker with respect to some emotions that I'm experiencing. And I want you to be able to paraphrase plus identify whatever emotions that I might identify. Does anyone want to volunteer for that second piece? All right, I may have to call on people if no volunteers. All right, how about we go with
I think Leona said she volunteered. I seen her hand go up.
Yeah, okay. All right, perfect. So is this, because I feel like we got 3 Deannas, and so which Deanna is this?
Oh, did somebody else volunteer? Someone else can.
It was Leona.
It was Leona.
Okay. All right. All right. So Leona, how about you unmute yourself? All right. So here we go. Let me think about this. I'm gonna come up with a different scenario. All right. Let's go with relationship. And I'm getting disappointed here today. I just got broken up, by my spouse, or let's say girlfriend. Got broken up by my girlfriend, and I'm really having a rough time here. So I'm going to give you some content, and I'm also going to give you some emotional pieces behind it. All right. And so, Leona, are you prepared? I don't see you on the screen, and I just want to make sure that you're unmuted and ready.
I am unmuted. You don't see me?
Okay, I can see you now. I think that's just required for you to speak. Okay.
Okay.
All right, and scene. So I just don't understand it. We were doing great. I mean, we had been together for 2 years, and she called me and basically said that she didn't want to be with me anymore. And my initial response was, well, what's happening? What went wrong? And she came up with, all kind of BS reasons that to me didn't really make a lot of sense. But I guess I have to just accept what she said is her reasons. I mean, I'm definitely going to try to see if I can save it, and I'm going to reach out to her again, but I'm completely devastated. I find myself, feeling depressed, feel myself thinking about her constantly throughout the day. Whenever my phone rings, I look at the phone and I think it's her going to call me and explain things a little bit more, but it's never the case. And so I'm angry, I'm frustrated, I'm devastated, and I'm depressed. I don't know any other way of putting it, but this is really just a tough time for me, and I don't foresee that things are going to change anytime soon. And so, I'm really going through it here.
Well, thank you so much, first of all, for just sharing with me. I mean, it's a really vulnerable time. And I heard you say a lot of things. You're really going through it. And I heard you say just feelings of depression and just devastation, and that you're confused, and all of your feelings are really valid right now.
Leona, good job. Good job. Let me say what I even liked about what you said. And we have to be careful about this, but you were accurate here. So I don't think I used the word confused. At least I don't think I did. But you said confused, and that accurately describes kind of this, I don't know why she broke up with me. We were doing well. And maybe I did say confused and I think about it. But nonetheless, you did a great job with identifying the pieces that were relevant to my emotion. If I had to kind of give you any little mini snippet, just remember that the reflection also includes the paraphrase. So you do want to give that a good amount of emphasis, and then you kind of transition over. And so it's a skill that I'm wanting you guys all to work on developing. And so far, you two both who volunteered here did great jobs. And me as the recipient of this, I felt very much like I was heard and I had the floor to be able to talk. And so, Leona, great job on that one as well. Okay. So let's move on. I want to give an opportunity at the inquiry phase. And then once again, I kind of felt like I did this a little bit backwards, but the role that I'm going to play is someone who is a little bit more less likely to share. And so the person who's going to do the opposite end of this role play is going to have to push me a little bit. And I'm not asking you to do rapid fire questioning, but remember the inquiry phase is more of what happened? Are you okay? How are you doing? And whatever relevant questions that you see to try to get me to expand a little bit, right? And so I'll ask first if anyone wants to.
Man, what is wrong with you?
Okay.
You don't want that.
Well, that that's very likely to make me feel like, well, wait a minute. Well, wait a minute. Is there something I'm doing here wrong? And so there's a time and a place for, a confrontational sort of question phase. But certainly if I'm in a vulnerable stage, for someone to word it like that might be a little bit tough. Armando, since we got you on, I'm just going to go ahead and use you again. And all right. I am, let me think about this for a moment. I'm gonna come up with something truly traumatic here.
Wait. Since you're using me again, you need to give me the details one more time. Just give me a recap.
So this is the inquiry phase. All you're going to be trying to do is you're going to ask questions, inquiries about, you're trying to get me to open up. So I'm going to play someone who's more inhibited and less likely to just kind of come out and share as I was in those other ones, right? And so. All right, scene. So just really been a rough time here. I mean, we lost our child. He was 2 years old, and just really, I mean, part of it is confusing, but he died, and it's really tough.
Wow, yeah. I can't say that I know how you feel because I don't. I've never been nothing like that. Do you mind me asking the circumstances that surrounded?
No, I know there's a big part of me that wants to not talk about it, and I talked to my primary care physician, and he said that I should probably talk to somebody. And so, with you being my good friend, I appreciate you, and as much as it's really, really difficult. I think what happened was it has something to do with the asthma treatment. And, we have an at-home contraption that we use, and it has something to do with that, where he stopped breathing, and, we tried to do CPR, and it just was, we called 911, and next thing you know, it just was nothing else we could do.
It's got to be difficult. I sense that there might be some anger too. I mean, again, correct me if I'm wrong, but
yeah. Well,
I'm sorry. Is it causing like you and your significant other to maybe not get along? Maybe
you got it. I mean, she's pointing the finger at me and saying that I didn't clean the asthma pump, and I kind of feel as if she didn't, she wasn't there. It was her time to watch our son, and she was off cooking. And I get it that we need to cook, and we need to make sure that there's food on the table, but ultimately I just think that she could have done a little bit more. And so we've been arguing like crazy.
I guess trying to, I would say, I got a question for you. Are you guys communicating at all outside of this situation? Is there any other communication?
We're communicating. We just are not communicating very effectively. And, we're arguing and calling each other's names. And you know, there's been some threats of divorce, and you know, it's been really tough here.
Oh, you got to come up with a plan, I would say. I mean, where do we go from here? You know, do you have any thoughts about what you want to do next? I mean, like, you know, do you have any
Okay,
thoughts about it?
insane. All right, Armando, thank you again. So let me say this. I think specifically when someone is not as verbose and not as sharing as some of the other examples, we tend to want to, sometimes what people do is they rapid fire questions, and that certainly isn't going to be helpful. I feel like in the beginning of that role play, you did a wonderful job, and same thing. I like how you say, correct me if I'm wrong, because that gives an opportunity for clarification. I feel like you connected, you showed empathy, you showed genuineness and understanding. The one piece that, you know, we have to be careful of, and I think we tend to go here if we feel like we don't really know where to go. But in the end, you said, all right, well, what are we going to do about this? Right. And so, and so it's that solution piece. And once again, I think we as people, we want that, like, that's a sign of, I want to help. I want to help you get to wherever you need to go. And what can I do? And so I'm glad that you did that, because it allowed everyone to see. And I don't know, I mean, I was a part of the role play here, but for someone who has a child who was lost or something hugely impactful like that, the solution phase needs to come at a place where they're ready for that. And so I just want to once again caution us all, including myself, to not go there too quickly. But once again, Armando, you have really good listening skills. I can imagine that translates in your life. So thank you again.
Thank you for the opportunity. Appreciate it.
All right, perfect. Yes.
I have a quick question, just like kind of like a scenario-ish question.
Okay.
So when we're in groups with the dads, or even with moms, or whoever we're facilitating, and people say things like you said, like that kind of scenario in a group, I think sometimes people just freeze and just don't know what to say, and just don't know what to say, or say something to just like get to the next thing and the next topic. If you could offer just some phrases, like when someone said, because I put that was tough. Like I was like, oh my gosh, that was a hard example you just gave, right? What are some phrases that we can kind of just remember, or some techniques to kind of like calm that panic when someone says something like that and then they're looking at you like, what are you going to say to me now? So we kind of can stay connected in it and not get all, you know, bugged out.
So that's a great question. And so my first response is really, you know, if we're in a group setting, let's I'm just kind of picturing this in my mind, that there are 6 or 7 people there, and you are somehow the facilitator or the leader of that particular group. And I'm going to make an assumption here. If my assumption is correct, that we are, the people in that group are seeing you as someone who's been tasked with having some tough discussions, and or just kind of discussing whatever's going on in our lives in the stressful sort of capacity. Sometimes it can very much feel like, oh my God, I'm over my head here, right? And so if that's the case, and you're feeling, I don't know what to say, I don't know what to do, I don't know how to really address this, certainly your comment about, well, let me make a comment here real fast and let's move on to the next question, which certainly is going to change the dynamic of that room, right? Everyone's going to be feeling like, all right, we're missing something here, or so-and-so didn't get what they needed from this. So I guess the first piece of, and this is advice, the first piece of advice that I have is, don't make yourself feel like you need to be the expert, right? So if you feel like you need to be the expert and you need to give, you know, the perfect words to soothe this person, you're probably already losing. And in that example that I just gave with someone who's lost their 2-year-old child, think about this. What can you say that's going to make them feel better? nothing, right? There's nothing that you're going to say to make them feel better. You can listen to them. You can provide a forum for them to get out some of their feelings and thoughts and emotions, but you're not going to achieve the goal of making them feel better. So if you can kind of put that in your mind first, then you probably take some of the pressure off yourself to all of a sudden be somebody who none of us are, including myself. You put me in that situation, let me tell you what I would do. If I were in that situation, I would first ask, and this is a group, I would ask, is there anyone in this group who would like to offer some words of support to John Doe, right? And so, first of all, it is taking the pressure a bit off of you to have the right words. And I can guarantee you, in that example of 7 people that I just gave, someone's going to say, I'm really sorry you went through that. And this is what happened to me when I was younger, or I lost my younger sister. Like, that's really kind of how and why group therapy really works, is that it's the sharing of information and you don't feel like you are the only one who's been through that. And so by even just asking other people to offer their support, that's going to get the discussion started, right? And then from there, I think the important part is to just acknowledge, right? Like, me being a therapist, a little bit easier for me maybe than others, but not necessarily, because you guys are great, the 2 examples we had. But what I might say is, you know what, I just want to acknowledge, how difficult it had to be for you to disclose that, right? Like, it's not easy to talk about something that has largely impacted us and is likely going to be something that's going to be with you for the rest of your life. And I just want to let you know that I recognize that's a difficult thing for you to even say. Now you've broken the ice. It's not like this taboo sort of topic to talk about. Guarantee you some other people in the group are going to then comment as well. Now, I'm trying to take myself out of the supervisor role of supervising someone who's a true group therapist, because there's things that we do that are going to be, a little bit higher sort of level here, but we all have our therapists in us. And just imagine that someone in your family had gone through something rather arduous. You are likely going to have some of the skills to be able to make that person feel like you care. And that's all we can really do, is you providing a forum for transparency, for vulnerability, for showing that you care, for showing that their emotions are normal and aren't alien and foreign, and whatever else it is that other people want to really say. And so I think there, you gave a really, really powerful question for me to answer there. And I'm sure all of you on this call here today have been in some situation where you felt, whether it's a group setting or individual one-on-one setting, where you felt like, this is really tough stuff. What am I going to do with this? And so I'm hoping that just some of the things that we have talked about in terms of some of the basic listening skills, that you can kind of try to work on that. Let me even encourage you all to, in all of your relationships, I'm not saying just intimate relationships, with your parent, with your coworker, with your children, with everyone who you deal with, practice some of these listening skills, even if it's just the summary phase or the inquiry phase. And I can guarantee you're going to start to see, like, wow, I'm a little bit more talented at listening than I thought. And, the fellas out there, right? So let me just put the elephant in the room. Us fellas, we supposed to not be able to deal with emotion, right? We supposed to be strong and not even acknowledge emotion. It's my personal goal, at least on a local level, to dispel that myth and let, the fellas know, like, all right, you actually can be a better spouse and a better husband and a better father and a better coworker by being able to acknowledge and expand your feeling vocabulary. There's nothing feminine about that. And in essence, it's just going to create more feelings of trust. So I'm hoping that that at some point in the future, the whole machismo sort of, I need to solve all the problems and be strong. I hope that goes away at some point.
JC, I got a quick question to
Please.
go back to Dara's scenario. What if you do open the floor and you say, does anyone want to offer some support or encouraging words or something like that. And then when that happens, one of your group members starts to do some of the things that you shouldn't do, like give advice or things like that. What is a good tool to kind of reel that back in?
Yeah, good, very, very good
Great
question.
question. Great question.
It does happen, right?
All the
So it happens all the time. And so here's like the true sort of, I mean, this isn't a solution. This is more of a way of better managing it. And so let's just take the scenario that this is kind of a men's group of some sort, and we didn't necessarily expect this to happen, but someone discloses something traumatic and truly impactful in a sensitive topic area for them. So it's not like there was any planning for this, but it came out. You know, as I am getting ready to say, does anyone want to acknowledge and provide some words of support? I would say, well, let me add the caveat. I want us to be careful to not make this a advice giving solution session. What I think John Doe needs right now are some words of support. So if we can just kind of limit it to support right now, I'd appreciate that. So you can word it in a way where they understand. And that's kind of how group dynamics works, is that everyone doesn't know what their role is initially. And as you start to norm what's going on in that group, then they say, oh, the leader is looking for some support and they're looking for words of encouragement as opposed to solution. All right, I can do that. And then they give their piece. And so I just think that it's important to be able to do that. Okay. I think we had another question.
Yeah, really, really quick. I think some of your listening skills sound like some good group agreements, actually, also.
Sure.
And should be incorporated into just how the group works together. We did have another question. I believe Ignacio had a question or a comment.
Yeah, how you doing? This is a really helpful, just perspective, and for those of us that have gone through some similar approaches, like reminders, right? And so one thing, just talking about just even accessing those emotions, a lot of times, including myself, cannot find words to what's going on. And so I've used the metaphors or images as a tool or something to tap into that may be better able to explain. Sure. One of the things that I've used concretely and introduced it in groups with dads and with young men is around connecting emotions with the colors. And so using just a crayon box as an example. There's the 8-pack, they have 8 crayons, and then there's the 64-pack or the 16. And a lot of times it's how do we tap into those emotions? A lot of times including myself, I might only have access to 2 crayons, right? The red and the yellow. And then getting into a conversation of what do those colors represent to you when it comes to how you're feeling. And so getting them to connect that's not how I feel now, but it's along the lines of these emotions are connected, red, angry, yellow, happy, green. There's certain colors that go with types of emotion or feel. Yeah, blue, and I just want to introduce that as a way, because sometimes it may not be I feel envious, but it could be there's another connection to what it is, and also maybe a reminder once someone's in the moment of how to access that level of emotion as a way of practice. So I just want to introduce that as a way to whether it's individual or it's in a group setting, try to find creative ways to access things, but also have conversation around it in other ways as well.
No, Ignacio, I appreciate that. And I'm sure if we were to kind of tap into all the different things that everyone uses in this on this call here today, we probably are going to get some really unique and creative sort of methods. And so yeah, you're completely right. I think your initial point is really one of everyone doesn't have the feeling vocabulary to be able to identify what they're experiencing. And so whether it's the crayon piece and using that as a segue of connecting to emotion, I mean, just art in general, right? And so sometimes people, I use art very broadly. It can be a picture that you draw to describe, the plight based on what you've experienced. It can be a poem. It can be a story. It can be abstract art. It can be lots of different things. And so, Ignacio, I think you raise a really good point, that you also have to be very mindful of the audience that you have, right? So if your audience is 13-year-olds, right? Like, I mean, their filling vocabulary is limited anyway. Or if your audience is just a bunch of men who are like new to this whole world, their filling vocabulary is limited. Or people who have been largely impacted by stressful events, their filling vocabulary might not be limited, but their willingness to share and be able to access what those emotions are can be limited. So you certainly have to get creative in terms of how you access those pieces, or you're going to stay in the head, right? We don't want to stay on the cognitive level. We want to make sure we connect at the emotional level as well, because that's where, at least part of where the processing is a little bit more successful. So Ignacio, thank you for that. Does anyone else have any?
Julie was next.
I just want to piggyback off Ignacio. We use a similar type of strategies in some of our groups, and we do that so that it separates the person and the behavior. We're not bad people. We just have these types of responses, and we found that it makes it sort of evens everybody out. We're all just people, and we all have, we're just people, and these behaviors can happen to everybody.
Yeah.
And that's some of the feedback, you know what I mean? And it really does allow folks to make those connections in a more visual way.
Yeah. Yep.
So thank you for saying that, Ignacio.
Julie, I like that. So certainly, I mean, I think we connect with insight and awareness to a lot of different things, right? And so looking at your behavior, I mean, even just identification, someone may not realize that engaging in multiple relationships, and it tends to be men more than women, although it can happen on either gender, but people tend to not be able to sit back, analyze, and understand that there's a function behind this behavior. I'm out just dating a whole bunch of women and having intimacy relations with a whole bunch of women. What's the reason for that? Is it society's view of saying you're not a man unless you do that? Is it that you are trying to get validation from multiple people and you feel better when someone gives you a positive sort of comment about yourself and is willing to share their body with you? It can be lots of different things, but ultimately, if you can't step back to analyze your behavior, then you're bound to repeat the same behavior again, right? Sure. Okay.
Leona has a question.
Okay, Leona.
I just had a question / comment. Just when you were saying, sit back and analyze, something that I remember just years ago from a counseling class, and it just really, really stuck with me. And it's really hard to do, is just to sit and pause and like give time for the other person to respond, because like you said, in any situation, especially when it's really hard, you just want to like get in there and help, and you want to pour out your heart, and you want to but it's like it's like less is more. You can just validate the feeling, and then sometimes that's all you need to do, and then just let them speak, like be comfortable with silence. And I just remember hearing that, and it made me feel uncomfortable to even hear that statement. Be comfortable with silence. But sometimes it's the silence and just really understanding that the silence doesn't necessarily mean they're uncomfortable, but that they're thinking, that they're processing. Correct. And when I really started to hone that in any relationship, whether it's personal or professional, it really, really changed the trajectory of like how I go about my active listening. And it really made me go inward and like, why am I not comfortable with silence, right? And all of my, So I just wanted to put that on the table, because it's really hard to, and then with this pandemic, not having connection, and then thinking about when you're working with your families or whatever your population is, and being comfortable with silence when you're working with them, it's really difficult, but sometimes it's key.
Sure. No, Leona, you raise a very good point. Silence as a intervention, right? As the person who is the listener in whatever role that you're in, it is powerful. I mean, and you're completely right that it at least partially allows someone to process and get to where they need to get before they can share it. But if you remember, there was this movie called Antoine Fisher. I don't know if you guys remember it or not, but nonetheless, he had to use silence with Antoine Fisher because Antoine Fisher wasn't ready to talk about what was really going on. And so I think that was just a really good example of, all right, you're going to come, we're going to sit here, I'm going to do my work. And, you know, at some point you're going to feel uncomfortable enough to say, you don't want to waste your time. And that's his own little unique piece. But even within a individual sort of scenario, less is definitely better than more. And the advice giving, the solution seeking, rapid fire questioning, there's all sorts of things that are going to make the person feel a little bit less hurt and understanding. And even if it's just you saying, you know, I know that this has to be tough, and you stop, like that, like they're going to continue to be in their process of feeling what they're feeling. And then the other piece, Leona, that you mentioned, that, you know, I'm glad you mentioned it because I almost forgot this, but we, as in our society, we want to get rid of negative emotion as fast as we can, right? So if you feel depressed or anxious or angry or whatever the case is, you want to get rid of that feeling and go back to normal level of functioning as fast as possible. We as human beings experience emotion for survival reasons, right? If we didn't have fear, then some of the, you know, in the primitive days, we would have been slaughtered by all the other animals and we wouldn't be where we are now. And so all of our emotions have a function behind it. And I like to encourage all of my clients to, like, look, you are experiencing anxiety. For example, you have a big exam coming up, you got test taking anxiety. If you have no anxiety at all, you probably have not taken that test seriously enough to put the work in. And if you have too much anxiety, and that anxiety, you know, supersedes kind of your ability to really focus. But some anxiety is necessary for you to perform in sports, in relationships, in tests, and in everything. And so I like to encourage people to not rid themselves of that negative emotion so fast. You have to be willing to be vulnerable, to be in that situation where you experience that severe version of depression, right? And that may sound like counterintuitive to, okay, you're supposed to be treating a depression. Why are you having me even further in the depth of this depressive episode? When in actuality, that is part of the process to get to the other side. What do they say? You got to walk through the valley of the shadow of death to get to the other side. And so you just kind of triggered that thought in me, Leona. And as much as, you know, in all of our roles, we just have to be careful once again. Say, all right, this person's going through it. How can I get them to not feel what they're feeling as fast as I can? If that makes any sense, right?
Mm-hmm. Thank you, Jason. Anthony has a comment or question.
Okay.
I wanted to say that we've had a couple of difficult conversations in our group, not the virtual, but when we used to do our live groups. And I remember some losses in my own family and I, in my own experiences. You know, I mean, I think in a situation, like when you said that, when you gave the example, Jason, of what this particular one, it hit me hard. Like, I'm like, I don't, like, that's something that, that would be super traumatizing for me as a father. And I just want to reach out. I would want to reach out to somebody who I can imagine and just say, I love you. Like, and well, I'm sorry for your loss and that you are loved in this group. And I know that in a group setting like that, we have to be careful about what this person would kind of harm or trouble they're going through. So you want to be careful with the entire group. And one of the things I always say is like, it's okay not to be okay.
Sure.
You know, like
Sure.
it's like that. I think you said, Leon, about being uncomfortable with silence, which I really like. And also that just to state that, like, it's okay to be,
Yeah.
it's okay. You should not be okay right now, you know, and then I say just pause and let the group like maybe move on or give us permission to come back to this conversation if they're not ready to talk about it at that moment, or just have some space to hold that and not be okay with it, I guess.
Yeah, no, thank you for that. And just briefly, I'm in agreement with you. And certainly when we are hit with some tough piece as a provider or the parent or whoever the leader is and so forth. I like how you said, you know, just being transparent about that. We have to humanize ourselves as well as who we're the group leader or whatever role that we're in, for us to just look like we got it all together and that we can solve the problem, you know, at the snap of a dime. That's not making you really connect as well as you should. I think for you to be able to be transparent and say, what you just said a second ago really hit me. And, you know, I'm having a hard time finding the words to like that humanizes you too. And so don't diminish the power of transparency and vulnerability, no matter which role you're in. And so I appreciate that.
Yeah, I appreciate that comment as well, Anthony. And for folks who are hosting these groups, I mean, a lot of these dads and these parents that we're going to be working with over the next several months and years even have experienced some pretty significant loss given these times and COVID and all of that, whether it be job loss, whether it be literally, you know, close ones, loved ones that we've lost. So these are definitely skills that we're unfortunately going to have to use and have to sharpen because of just the time that we're in. So I appreciate those comments.
Any other questions before we kind of move on to the kind of last phase of today with some kind of sort of handout / kind of takeaways? Any other questions before we move on to that?
Two things. One is behaviorally, I just thought of this, is a person that's like always joking and never serious. It's like always a joke. Like, what's wrong with you? Like that. Yeah. And then the other thing that you mentioned was our feeling vocabulary. So if we have time, I know you have other things you want to talk about before the call in. How do we increase our feeling vocabulary? How do we do that in a group?
Yeah, no, I think that's a great question. So there are lots of, you can easily go online and just type in feelings chart. And you've seen it before. There actually is like 84 feelings on a one-page chart, right? And some of them are like the primary emotions and you see them every day, and some of them get a little bit more complex. And so in every group that I've ever run, I've had a feelings chart laminated. You can get it laminated at FedEx Kinko's for like 35 cents. And you be able to pass that around. I know we're talking kind of non-COVID sort of territory. You can project it onto the screen in the COVID sort of setting. But whenever I see people, you know, they're trying to access their emotional piece, but whenever you hear someone say, well, I feel like, they're out of the feelings, right? Anytime I feel like I should do this, or I feel like this is really, you know, I want words that are feeling and emotionally based sorts of words. And so it's not like I try to make it so it's like I'm not making you feel like you're not intelligent or you should know these, but I'm going to hand it to you and say, help me understand which, you know, what you're trying to say, which of these words you can really relate to here. And the more you do that, you'd be surprised how fast people's feelings vocabularies can kind of expand. So you got the picture version, you got the descriptor version. There's all sorts of feeling vocabulary charts that are out there that you can easily access for free. And then your second question, I think, is a really good one. You know, we could talk about defense mechanisms for an entire session if we really wanted, but you got all sorts of defense mechanisms. And I really feel as if, even though the movie didn't necessarily focus on this, but the Joker movie, if you've seen that, right? Like it started off, in the latest one, that's the only one that I saw, but it started off with him going through a really tough and arduous childhood, and he found his way of being able to interact in the world through this facade, and the facade was the Joker character, and being able to, you know, laugh things off even when they're emotionally charged. And I'm not doing the movie very much justice in terms of describing what it is, but there are people who they use laughter as a defense, right? So anytime things are difficult to access and process or even consider, you may see them laugh or tell a joke or what have you. So to me, that's a sign or an indication that this is the serious situation for this person, right? And so what you don't want to do is that you don't want to laugh back with them, right? If you laugh back with them and you now see it as a joke, then you help to maintain that defense. If you maintain your assertiveness and you have a discussion about it, you can kind of, not offering this as like the solution to their defenses, but it can certainly break down some of those walls. And I have a client who I work with to this day where that's her primary condition. And we've made some pretty good strides, and she catches herself all the time now, like, oh, here I go doing that thing again. But that's one of hundreds of defense mechanisms, right? Denial is another one, deflection, distractions. There's all sorts of like defenses that make it so that we don't have to deal with the difficult material. And I just want to respect everyone's readiness or not readiness when it comes to difficult material, and not try to push people too fast. But you can kind of see that behavior in many people and understand that it's the defense, right?
Thanks, Dara. We've got Sybil has a question, and then really quick, we had a question in the chat about the word vulnerable and how sometimes that shuts guys down. Is there another framing or rewording other than vulnerable that you can use?
Yeah.
And then we'll go to you, Sybil.
So that's interesting, because I personally feel like the word vulnerable it's kind of suggests like break down your strength barrier, right? And so for men, I can see that as being really tough. Whether you want to use the word transparent or genuine, those are like synonyms for it. But to me, vulnerability kind of has a little bit more of a, like the more meaning of vulnerability really has is just that it's despite whatever the response is going to be. Like, you might not want to have a tough discussion with your significant other because you're fearful that they're going to pounce on you, and they're better orators than you, and they're going to take over. And now you're going to feel like you did before, where you don't have a voice. So you don't have those discussions. To make yourself vulnerable or transparent or genuine, I guess, if we want to use that. But what it means is that you are willing to go there despite whatever the ramifications are, despite whatever negative piece that you might have going. In effect, you almost want that to happen, because what happens is that we get conditioned so much to not have those conversations that we avoid the heck out of it like the plague. And so if I'm your treating clinician on that, my checkbox for you is going to be, I want you to feel that version of frustration or that version of isolation or whatever. When you have that conversation, I want you to sit with that. Ask yourself questions around it. Is this something that you feel comfortable with? Is this something that you've ever solved in the past? So I'm sorry, I feel like I'm going on a tangent here a bit with the term vulnerable, but I just wanted to expand it a little bit more. Like, when you're really doing the work, you have to make yourself be willing to experience that emotion once again. And if for whatever reason, history or trauma or whatever, if you're unwilling to really go there, how vulnerable really are you being? And it can be really tough. But to answer that prompt, maybe genuineness or transparency are like words that you can use to kind of ease into it maybe later on. Stick it in there once you made progress.
Thanks. And this will be our last question given our time. Sybil.
Super brief. I don't want to take any more time. I am here just as a white mother of 3 beautiful young Black men, and they're all in their early 20s. And I'm from Stockton, and we don't have anything like this. We are completely closed off to any kind of Black Lives Matter or any type of Black counseling support groups for fathers. I'm wondering if this dad discussions that you have is open to my son, who is a father, even though he's from Stockton. Would that be open, or is it only Alameda County?
That's an easy question. Absolutely, it is open to everyone, anywhere.
Okay.
Men, women, fathers. It's geared towards fathers, but we often have father figures, allies that attend as well. So yes, and if you are on this list now, since you registered for this training, you will get the announcements for dad discussions.
Great. Okay, I just wanted to be sure before I
coax my son into reaching out, because it's very
Absolutely.
difficult for young Black men to reach out in any way, shape, or form,
Mhm.
especially in our community out here. So I appreciate
Absolutely.
your time. Thank you.
Absolutely. Thanks for asking.
Thanks,
course.
Sybil.
Kevin, could I just jump in real quick and just add what I put in the chat? Is in Stockton, there's a Fathers and Families of San Joaquin. It's a nonprofit organization out there. So I just want to put that organization out because there may be some additional resources available in the area in
Yeah,
addition
they're
to
not
what we're offering
too,
to fathers.
they're not too, they're more Hispanic. They don't really have the large following in the Black community. But I appreciate that though. Thank you.
Thanks, Ignacio. Thanks, Sybil.
Can
Go
I,
ahead.
can I just add to that? And just another sidebar, Sybil, we have our fatherhood groups for this one, but we also have another group that we're starting that's going to be open to any father anywhere. And it's going to be led by an African-American male. You know what I mean? He's a part of this Fatherhoods Corps, and it's going to be open to all fathers.
I think it's going to be pretty awesome too. I know Mr. Lewis, myself, Michael Lewis, and I had a discussion with him recently, and I'm excited to see what that. You know, I know we got the Spanish one going right now with Juan. Hello, Julie. We haven't met yet, but I've been speaking to both of your father engagement specialists, just trying to connect with them. And to the lady from Stockton, I'm in Stockton myself, but I'm transitioning back to Hayward. I'm going to be working out of actually Richmond, San Pablo, Antioch, Pittsburgh, Bay Point. That's going to be my area. I'm the new fatherhood engagement specialist out of Contra Costa County. So we're rolling out a fatherhood program, and it's exciting, but it's in the beginning stages right now. So any support, I want to put my email in the chat box. Anybody want to connect with me, I'd really appreciate it. Mr. Darren White, appreciate you as well.
Thanks, Armando.
Yep.
And just so you guys know, we are currently, Virve is working on putting together a calendar that has all of your groups that will be launching or have already launched, so that we'll post that on our webpage so that folks can access and always be able to find a father's group for your clients or anybody in your family or network. So we're working on getting that finished up as quickly as we can.
Thank you, Kevin.
Absolutely. So Jason, do you have it? Jason, do you have any final thoughts, comments?
So just final words. I won't be able to have time to talk about it, but I'm sure that Kevin and Derek can send it to you all. But I have a handout, and the handout is just a one-pager, and it lists a number of paper and pencil trauma assessments. And so these are the ones that don't necessarily require, they're like Likert scale, they're pencil and paper, they're pretty easy to score and kind of get an indication of where people are. I also put some book recommendations on the one pager as well. Some of them are specific to trauma. Some of them are specific to just kind of people of color sorts of issues. And then I also listed some local resources. And when I say local, it's not necessarily local to Alameda County, but it can kind of expand, and you can kind of use those to for your own area. The last piece is just that I guess I need to kind of at least explain it a bit. I just want to encourage you guys all to embrace the concept of self-care. This is something that I kind of feel is like a pillar of mine. And we in this fast-paced society, like even right now, I'm probably going to go get some fast food, which is bad, but we need to embrace that concept and expand it above and beyond. It's more than just going on vacation. It's more than just exercise. So I just want to kind of put a call to action for everyone to digest that concept. And so, with that being said, thank you guys for participating. Thank you for your comments. I mean, I got a really vibrant group here. You never really know what you're up against when it comes to a presentation, but you all really made it easy for me here. And hopefully you take away some things that you can kind of integrate into your work.
Thank you, Jason. Thank you so much for your time. Thank you to all of our participants and Fatherhood Partnership mini grants folks. Have a good weekend. Keep